Welcome to Health Watch. My name is Damian Grange and I'm the Marketing and Public Relations Manager here at the BVI Health Services Authority. On Health Watch, we will discuss all things healthcare, the organization that is working to improve your care throughout the territory and your health. With me today, we have members of the mental health team as we continue to focus on Mental Health Month and Mental Health Day, World Mental Health Day. With me is Shanna-Kaye James-Bell. She is a psychiatric social worker with the Substance Abuse and Mental Health, Community Mental Health and Substance Abuse Services, and Nurse Wayne Archer, Mental Health Officer with the same department. Both of you, welcome to Health Watch.
Thank you for having me.
Thank you, Damon. Thank you for having us.
Great to have you. I am very close to the mental health team because when I joined the Health Services Authority, I actually started in that department. And so I've remained close to the team, and you guys make sure that I remain compliant with my treatment so that I'm able to function. So thank you very much.
You're welcome.
All right. You know, there's no shame in the game.
There's none.
We are working to destigmatize mental health. And I'm not afraid to say it. When I need it, I run to the department and I'm taken care of. We want to talk about World Mental Health Day. Talk to us about the objective and the focus, especially on the ground.
Okay, so the objective and the missions for World Mental Health Day is to raise awareness about mental health and particularly to raise awareness in the BVI about reducing the stigma and discrimination associated with mental health. And I like the theme the World Health Organization used for this year's Mental Health Month, that mental health is a universal human right for all. And indeed, why shouldn't mental health not be a universal health for all? Every human has the right to be protected from mental health risk, and every human has the right to available, accessible, and acceptable quality mental health care. Right. And that is what we are striving for in the BVI.
Awesome. Well, that is great. I too like the theme because I do believe that we all should have that right and access to quality mental health care. Why is it important for us to continue to raise awareness on mental health?
Well, Damien, as you would know, mental health in the past was also looked at as taboo. Something you don't talk about.
That is true.
Kind of switch on you up. So we want to change that because healthcare is a basic human right. Mental health care is part of healthcare. So we want people to be aware of that.
Yeah.
Okay, and in so doing, we will get people to come forward who really needs the service and will not be afraid for whatever reason to hide away from, getting treatment and care for something that is afflicting them or might have been afflicting them for a long time.
Yeah.
So we really need to raise this awareness level. And we've been doing that for quite some time. We've been getting good response and we want to continue.
Right. I mean, I know you guys have been in the service for quite some time,
Yes.
and I don't know if you're able to speak to this specifically, but are you able to speak to the cross-section of the BVI community that is mainly affected by mental health care, or is it across the board?
Well, the BVI community is a very small community, so I'm not quite sure if we can actually speak about a cross-section. In addition to that, probably half of the people that work or live in BVI are not even BVI Islanders. So a cross-section may not be appropriate in terms of what we want to talk about. But what I can say is that there are some variables in the community or in the society that we can point to. Mental health illness has a familial or hereditary tendency. There's also an environmental one.
Yeah.
Lifestyle.
Right.
Okay. Also, stressful situations that would also encompass the environment that you're in. But for me, and the years that I've been here, one of the things I can point to is that substance abuse, including alcohol, okay, a great part of the mental health population or in the system, okay, has been affected by that.
So I think in our previous interview, that was also a concern raised by Dr. Ruben and Dr. Turno, that they realized that we're seeing excessive substance abuse, which is contributing to persons being mentally unwell.
Yes.
So that is something we need to caution the community on.
Correct.
And in terms of outreach, what is being done by the department to get to the community and get this messaging out? Because now that you're aware that this is a significant concern, what are we doing to address those concerns?
And this is not only a significant concern for BVI, this is a significant concern for other countries of the world. So I don't think that what we're speaking about here is unique to BVI.
Okay.
These are things that we're seeing worldwide. In terms of the service that we're offering, okay, we have a community-based program where we try to come up with treatment modalities to keep our clients within the community. That is what we are doing. Yes, we have an acute inpatient care program here at the hospital, but that can only cater to about 12 people at any one time. So our main focus is keeping our clients in the community, and we do that by home visits,
Okay.
home risk assessments. We visit the schools and different institutions and try to get a feedback on things that might be going on. So our program is fairly broad and outreach. We also have the psychologists who offer her services as well. And the social works department, Miss Shanna-Kaye James-Bell, she's very instrumental in going out there and looking after the social well-being of our clients within our population.
And to answer to the question you asked, not only do we go to the schools, we go out also to the corporate community. We educate those who are having difficult issues, whether with their environment, with their job, and also we partner with other organizations to spread the word on mental health. And also mental health, we have our own outreach where we'll have our health fair and the anti-stigma campaign that we're doing, that is also reaching persons in the community as well.
I like the fact that we're being proactive and trying to intervene early, which would prevent persons from actually needing to be admitted in the service. So I must commend the department, because I think you guys are doing a great job. Obviously, there are times when folks see persons who they think are unwell, and they start to throw the blame game, but I guess they wouldn't have an appreciation for the amount of persons that you guys care for that are actually doing well because of the service that you do. What support would you like, and that brings me into this question, from the community itself that would make your jobs easier?
Okay, the support that I would love from the community is for the community to show support for those who are living with mental health challenges, and to show support for those who are seeking services. We have started a conversation about mental health, but I know when we start a conversation, the topic of mental health might be uncomfortable for some, but once we start a conversation, this will break down barriers. It will reduce the stigma that is associated with mental health. So we want the community to show more support to those. And it's also empowering those, as Dr. Ruben always said, to be mentally well is fashionable. So we are encouraging those. And I would love the support from the community in that, to show their support.
In addition to that, I want the families of those afflicted to take a little more responsibility.
Okay.
So many family members tend to shy away. They want somebody else to deal with the issue. But if you have a family member that has an issue, somebody has to be able to take responsibility for that person. Yes, I know you might want to say they're an adult that can take care of themselves. That may be true, but a person that might be having a mental health issue may not necessarily be cognitive enough to be responsible for themselves, even though they're an adult. So somebody, closest relative, the next of kin, whoever that may be, should really be identified as the person that is going to come forward and say, hey, okay, I'm going to take responsibility for this person, and that would make the process more easier, not only in terms of immediate treatment, but in terms of long-term care.
Yes. Is that something you're seeing a lot, where persons aren't involved in the care, or you don't really have that issue?
No, unfortunately, I have to say yes.
Oh, no.
And it can be very frustrating.
Very frustrating.
It can be very expensive too, because as you know, to keep someone in hospital is fairly expensive.
Yes.
Not only for that person, but for the government as well, if they have to continue that care. So the faster we can get people in and out of the system, okay, it's better for both parties. And getting people in and out of the system quickly doesn't mean that there's a reduction in healthcare. Okay, it just means that the process will go more smoothly, and we'll be able to probably cater to even much more people than we're catering to now at this present time.
Okay, so message to the community: be supportive, help us to reduce the stigma so that persons are more willing to access care, and participate in the care of your family and relatives who are struggling with mental issues.
Yes.
And I like that, and by all means we should. In fact, we should participate in the care across the board.
Exactly.
Right? Because healthcare should be a family responsibility, right? From dieting and all of that. How can persons access the service?
Persons can access community mental health service by contacting our line by dialing 852-7570 or 852-7683, or dial the switchboard at the hospital and be asked to transfer to community mental health. That's how they'll be.
Right. We're trying to get the community involved. So let's say, for example, you see someone having mental health challenges in the public. What is the community to do in a situation like that? Do they just contact you directly, or do they try to intervene personally? Do they go through the police? How does that work?
Well, the police are the first responders, so if you think there's an issue, you should always contact the police first, and the police will get onto us. In addition to that, it might be an issue involving a known person who's already in the system. So in cases like that, you can probably call the hospital directly and ask for one of the mental health officers, and we can probably follow through from there.
Okay. All right. Very well. And how do we now get persons to take individual responsibility in supporting the mental health department?
Persons should take responsibility, as Mr. Archer said earlier, for family support. So if you're a family member have a mental health issue, take the responsibility, reach out to us. If you don't know how, we are there to offer support. That's what we've always been doing, to offer support. And also for me as an individual, to best support mental health services, I want to continue to raise the awareness, and I want to continue to advocate for proper mental health services and for those to access mental health services.
Yeah.
Individuals who are seeking mental health care need to stick directly to their treatment modality.
Okay.
All right, that include taking medication, attending your doctor follow-ups, make sure you're eating and sleeping well, make sure that you're coping well within the work environment. Not stressing yourself out too much. Making sure that you're doing all the things you think you need to do to remain well. Yeah. I know that there's still a lot of stigma attached to it. Yeah. But you also need to be aware that it's for your own individual good as well that you maintain these things. I don't think you need to be afraid of letting somebody know that you have an issue. Right. I know people tend to shy away from individuals who might be having mental health issues. We also want to implore them not to do things like that as well, but to offer support to your friends, your colleagues, your families, your workmates. Offer support to people out there in the community who are struggling with mental health issues, because things like this could happen to any of us.
Yes.
All right. We should not be saying that, oh, that will never happen to me, or that can't happen to me. That is not how life is. Sometimes we get these curveballs, as you Americans might say, or bouncers, as our West Indian people might say.
Right.
And you probably will have an idea how to really play them.
Right.
But there's help, there's support out there. You need to reach out. And even if you can't reach out, I hope that there's someone in your circle that can reach out for you, so that we can go forward and do the best we can for people like that.
So my self-care is I love tennis, and I love to go to the gym. So CrossFit and tennis helps me to stay grounded. And it's exactly what you say. It's not that you have this consistent challenge, but there are circumstances that may push you over the edge. And from time to time, I would find myself going into a state of depression of sorts, and I just need to get some exercise in, maybe go on the tennis court for a while, or probably call a family member and have a debrief. And I that's my coping mechanism and my mental health check. I don't know if you want to share your personal with the community or encourage them to do any that is the standard, because mine really isn't okay.
Well, for me, whenever I'm feeling low in mood, I will always listen to music. Whether I love reggae music, so that will change my mood. I will maybe call a family member just the same, or I will even speak to my husband just the same to change the mood that I'm in.
So that's great. So clearly your husband is not the contributor of your mental health. That's good. Okay, that's good.
Yes, I will journal also too. Whenever I'm feeling down, I will journal in my gratitude journal to say, okay, this is what I have that is working in my life, and to be grateful for it. So even if you're whether you're exercising, you're listening to music, you could journal, and even that could change your mood and your mindset to say, okay, I have a lot to be grateful, and I'm here today. And even though life may throw you a curveball, you have another day to fight. You could get up and go.
Well, for me, as Ms. James, but could confirm.
You play cricket.
I'm a fitness fanatic.
Yes.
If I'm not running, I'm swimming.
Right.
If I'm not swimming, I'm playing cricket. If I'm not playing cricket, I'm in the gym. If I'm not in the gym, I'm somewhere in the community with my friends sitting down, we talking, and
Right.
drinking one here a day, laughing, discussing stuff. So I'm always kind of occupied with one thing or another. I know that there are a lot of people in the community that can't really do that. They're bound by family, they have children, they have responsibility, but I want people to understand that you have to take some time out for yourself.
Yes.
I'm quite sure that everybody can take at least an hour out of their daily schedule, if not to relax, at least to exercise. Yeah, and that is something I want to implore people to do. Take a little time to de-stress, okay, on a daily basis, not on a weekly or a monthly basis. Okay, get out there and do something, whether you go walking, whether you go running, whether you go swimming, okay, but get out there and do something that you can de-stress with. I know some people might say, well, I normally do a lot of gardening. gardening is not exercising, or gardening is not distressing. Okay, do something that is going to take you away from your activities of daily living. Okay, do something that for the hour where you're not going to be bothered by somebody calling you, you're not going to be bothered by your cell phone ringing or anything like that. An exercise that is going to be solely for you for detoxification purposes. Yes.
Well, there you have it. Those are our mental health self-care tips. And I hope you have your own. We encourage you to do so. Get time for yourself. Self-care is mental health care.
Yes, and it is fashionable.
And mental health is fashionable.
Yeah.
I agree. Nurse Archer, Ms. Bell, thank you both for chatting with me on Health Watch. And I hope that throughout our discussion, somebody who is watching may take something that would have improved their condition or their mental health.
Thank you.
Thank you. Thanks,
All right.
Damien.
It was a great pleasure being here with you, and I hope that you are informed. Stay connected to Health Watch. We will continue to share tips with you on how to remain healthy from head to toe. I'm Damian Grange, and it was a pleasure.